Hello and welcome to Health Review. On this show, we discuss trending healthcare issues. We call government action to question and make suggestions on how to improve healthcare. Thanks for joining us on the show today. My name is Chika Onyesi. Okay, today on the show, we want to discuss the care of our internal organs, the intestines, the liver, the gallbladder, or the pancreas. And when we eventually have issues with these organs, how do we get help for them? Nigeria's healthcare system have the capacity, does the Nigerian healthcare system have the capacity to take care of healthcare issues relating to our internal organs? All these and more will bring you after this short break. Don't go anywhere. This is one of the hallways of the National Hospital Abuja. As you can see. Hey, welcome back to the show. You're still on to Health Review. Thanks for joining us again. Let's bring you a few health stories from the global health scene. Research from Denmark has found that women who have suffered postpartum depression are more likely to go through it again after subsequent pregnancies. The report says postpartum depression occurs 27 to 46 times more frequently during subsequent pregnancies. Lead researcher Marie Louis, an epidemiologist, says antidepressants and physiotherapy could help cushion the effects of postpartum depression among women. Heredity has been found to contribute about 83% of the risk of autism in children with the disorder. The estimate from an ongoing debate suggests that rare genetic traits combine in parents and explain about 8 in 10 cases of neurodevelopmental disorders in children. The study shows that genes are major factors in terms of autism. Okay, we'll bring you our fact sheets now. There are several areas when it comes to our internal organs, but for our fact sheet today, we want to focus on the liver. A fact sheet, the liver is the ultimate multitasker. The liver is one of the body's largest internal organs. The liver filters over a liter of blood every minute. The liver is the only organ that can regenerate itself. It performs over 500 different critical functions. Adults from 30 to 60 are most disposed to liver malfunctions. Okay, welcome back to the program. I hope you saw that fact sheet on the liver. We're talking about our internal organs today, but for a reason, because of the specialty of our guest, we want to focus on the liver today on the show. Okay, sometimes we often feel sick in the stomach. Sometimes we ascribe what we're feeling to what we've eaten, but most times it is not about what we have eaten. It is about what is going on with our internal organs. And so today we have an expert in the house. She is a gastroenterologist. That's a specialty of medicine where they study and take care of everything about our internal organs. Dr. Igwage Agnes Felix Udu is my guest on the show today. Doctor, you're welcome to the program.
Thank you very much.
Thank you for joining us on the program. There are issues. We often have issues with our internal organs, but a lot of times most people do not take these issues seriously. But we found out, according to research, that the mortality rate is high in terms of issues related to the gallbladder, to the pancreas, to the liver, and to which other part of the body now. Okay, there are so many of them in Nigeria that people suffer on, but we want to find out, how often do you see these issues, as a specialist in this field, how often do you see these issues present in the health facility where you work?
Okay, first I want to say my specialty also covers, apart from the liver, the stomach and the intestines.
Okay.
Now, a lot of issues with the stomach, people under-report because they self-medicate.
Okay.
Oh, I have an ulcer, take Gestid. Everybody takes Gestid when they feel some pain, even though we know that some of these things are actually, may not necessarily be ulcer, but may just give an abdominal discomfort or abdominal pain. So issues relating to the stomach and intestines are actually very common. But as I said, a lot of them are underreported because a lot of people self-medicate over-the-counter drugs for dyspepsia, ulcer, and gastritis, and all that. But when we come down to hepatic diseases, this is mostly very important because, number one, we have a very high rate of patients coming down with these diseases, mainly linked to the high prevalence of hepatitis, especially hepatitis B in our environment. So a lot of diseases are very common. Most of my patients actually are hepatitis B patients. On a weekly basis in my clinic, I can see up to 60 patients, and I can say 3/4 of that are hepatitis B patients. Then we have a good number of people with ulcer-related issues, and then some people with issues with the large intestine. But mainly, hepatic patients constitute the large burden on the clinic. And this, as I said earlier on, is due to the high prevalence of hepatitis B. Especially, we have hepatitis C too, but hepatitis B can be as high as 14% in some population, the prevalence, whereas hepatitis C is between 2–3%. So we have a good number of patients coming down with diseases related to the liver because of their hepatitis status.
Okay, so we can confidently say that hepatitis is a disposing factor to liver infection or liver failure.
Well, hepatitis B is an infection, it's a viral infection
of its own
of the liver. Okay, as I said, we also have hepatitis C, which also infects the liver. We have hepatitis A, we have hepatitis E, but the most common one and the most predominant is hepatitis B. And this infects the liver and causes reactions in the liver, which causes destruction of the liver cells and leading to liver failure, liver cancer, liver cirrhosis. So this is what creates most of the burden.
Okay. But ordinarily, apart from hepatitis causing this, increasing the risk factor of this infection, liver infection, what other factors can bring the liver down?
Okay. There are other factors include alcohol.
Okay.
We see a lot of people coming down with alcoholic liver disease. And this can also give you cirrhosis and liver cancer at the end stage with liver failure. Herbs. We've seen an increasing trend because there's this trend of herbal use that is really going around now. Herbs for these, different herbs, moringa, green tea, the works. And a lot of people just take these herbs because they are told, oh, they are natural products. They won't harm your body. But as you earlier said, the liver has a lot of functions. And one of its functions is to break down complex substances, detoxify them, and make them non-poisonous to the body. So when you take in these herbs, there are some other plant materials that are a bit heavy for the liver to break down. And these then damage the liver. So we have a lot of people coming down with liver issues from chronic herbal use, or from childhood they've been using herbs. And then over the years they have destruction in their liver. If it's an acute herbal use, maybe you don't use herbs all the time, you use for a while, and then you had some destruction of liver cells. Usually, we have said the liver regenerates itself.
Yes.
If you withdraw the offending drug or offending herb, as the case may be, and you supplement with vitamins and essential phospholipids, which the liver requires to generate itself, it will usually regenerate itself and there will be no issues afterwards.
I read somewhere that we do not need to detoxify the liver. Is that true? Because some of us take what we call bitters, the bitters. There are so many brands of them. Just because maybe you feel bloated, you feel you haven't used the toilet enough, and you want to feel free, and you take the liver, and they help you move your bowels. Are these also risks concerning the liver?
Yes, the funny thing, a lot of these bitters are herbal products.
Okay.
Which are also risks to the liver. You know, there's this notion that you have to detoxify the liver. The liver detoxifies itself for the products you take in. And if you don't take in products that will harm the liver, you wouldn't have any problems with the liver. The only, what I can say is, okay, if someone had been on herbal use and is now having some derangement in the liver enzymes or liver function, there are drugs we can give that, like as I said earlier, on some vitamins, essential phospholipids that will boost the liver's recovery. But I wouldn't call that detoxifying per se. You don't go regularly to take these bitters. They are herbs. They would still harm the liver.
But does it mean we shouldn't take herbs at all? There are healthy herbs. I mean, the normal ones.
The problem with herbs really is that quantity.
Okay.
We are not saying herbs do not contain some products that are valuable to the body that could help the body. But what quantity are you taking? In what quantity in a gram of the herb
are you taking in? Okay.
You understand? So a lot of people don't. I was explaining to someone, he said, oh, he takes moringa and his liver enzymes were deranged. And I said, oh, moringa is a normal herb. So I said, how do you take it? He said, because they cook it and eat it. I said, well, how do you take it? Oh, we dry it up and powder it. And I said, does it ever occur to you that when you dry it up, before you get a teaspoon out of that powder, there are a lot of leaves?
Yes.
But if you cook it, the amount you're going to eat in the soup, you can't eat it in the tea. Because you're going to need a lot more leaves to dry up and become powder enough for you to drink.
And of course, these herbal products don't have measurements.
Yes, there are no measurements. Okay. So even though, well, maybe there are 1 or 2 substances in moringa that might be good, but there's no way to measure it. Green tea is another common one, and I've seen quite a number of patients with derangement in liver function from green tea, because a lot of people use it for weight loss. It's supposed to be good, but when you start taking 2 to 3 cups every day for months, then something is going to happen. So we usually, I had a patient like that, and after we advised her and she stopped the green tea, by the time she came back, everything was back to normal. So we need to be careful with these herbal products when we take them, because they don't always help us.
Help the liver, especially. Okay, Ma, in your practice, how often would you say that you've seen cases of liver patients, people with liver dysfunction? How often do they present, perhaps in men, women, or children, who are mostly predisposed to liver infection?
Well, there are different spectrum, because the liver diseases, there are different spectrums. You can have, like the acute one we're talking about, someone takes herbs, it deranges a bit, it clears up. Then someone comes down with hepatitis B, chronic hepatitis B. Some people do not have symptoms. They have the hepatitis B, but their liver is fine. It's just that they have the disease. They need to be followed up. They are what we call inactive carrier. The disease is not active, but they need to be followed up to make sure that the disease does not become active. And when it does, the patient is treated. You have some people who might come with what we call liver cirrhosis. Some people will come with liver cancer. Okay. Well, in my practice, and I think this mirrors what we see here a lot of patients with liver cancer are actually young males. That's what I found. In fact, in the last month, I think we've had about 2 or 3 cases of young males dying from liver cancer.
Really?
Yes. So they're usually young males, hepatitis B positive patients. We see liver cancer in older patients, but the cause of their own liver cancer is slightly different. Usually the old patient with liver cancer is hepatitis C positive and has had maybe cirrhosis for a while, okay, or an alcoholic, okay. But the hepatitis B, usually they're young males, more in the males than in the females.
This is a serious problem, and we have a lot of young men who show off their faith by drinking, and you've mentioned that alcohol is a predisposing factor to liver disease. So alcohol is a predisposing factor to liver disease. I hope the young men are watching the program. Okay, let's move forward, Ma. When we talk about our internal organs, is there anything that one can do to prevent coming down with the liver disease?
Well, basically, what you need to do is live a healthy life. That's just it. Most of the time, the problems we have physically as per disease can be prevented when you live a healthy life. No alcohol, no smoking, no refined sugars, no herbal use, no indiscriminate use of drugs, because some people, they have a headache, their neighbor tells them, oh, I took this and this and this together and it worked, and no doctor prescribed it. You just go, oh, I have a headache. Okay, my neighbor said I should take what the Yorubas call, is it akakpo or akakpo? You know, they count all these tablets, oh, for back pain, for this, take it, and they swallow it. You don't know what you're taking. Those two can also damage the liver in the short run. So all you just need, eat a balanced diet. Avoid the alcohol, unprotected sexual intercourse, because hepatitis is spread also by sexual intercourse. So avoid unprotected sexual intercourse, avoid sharing of sharps, for the men, have your own clippers. Don't patronize traditional nail cutters. These Hausa guys that go around, they use the same things and call.
All of them.
If you go to the salon for a pedicure, make sure they use fresh
sharps, eh?
Yes, sharps for you. They don't use blades. They use a fresh cuticle trimmer. You know, so those are the things we really need to do. And if we do this, the idea of, oh, we need to detoxify the liver does not arise, because we are eating a balanced diet and we're avoiding those vices that we know that can ultimately harm the liver. Is
there anything like overworking the liver?
Well, overworking the liver comes from what I just said.
Okay.
You are taking herbs. You are somehow overworking the liver.
Okay.
Because perhaps if you took a cup of green tea, there will be no issue. But if you take 3 cups every day, your liver has to go detoxify that. So then you have a problem.
Okay.
So, but if you're eating a normal balanced diet, you're not taking alcohol, you're not taking herbs, I don't think the issue of overworking the liver comes in. The liver was put there for a function, to carry out its function.
Okay. Okay, so you mentioned that about a month ago or so, you lost some young men in your hospital. Can you give us an idea of how high the mortality rate in terms of liver or stomach infections are in Nigeria, in terms of what you're...
Well, for most of my patients with liver cancer, usually in cancers, we measure mortality rate with 5-year, 1-year, 2-year survival,
okay,
or 10-year. But we found that in our practice here, most of our patients don't last up to 1 year, and they're dead. Those with liver cancer. Occasionally, we've had 1 or 2 who were able to go out of the country and get some treatment. Lasted 2-3 years. But that's the occasional person. Most of the time, by the time they present, the tumor is so huge that there's really nothing you can do. And even those who are in the stage where you can do something, not everything can be done in the country. And they might not have money to go out and do these things. So the mortality rate is very high. For those with cirrhosis, the mortality is less, because liver cancer is a rapidly growing tumor which kills the patient within a year from diagnosis. But cirrhosis is just a slow decline
of the liver,
in the liver's function, because the cells have been destroyed and they've been replaced by scar tissue, just similar to when you have a wound and it heals with a scar. So you know that the skin that is scarred is not
same as a new one.
So you just have a decline in the function. So it declines over years. And a lot of our patients, we're still managing them, you know, give drugs to reduce the pressure in the liver. If they have any enlarged vessels that need to be tied off in their esophagus, you do that. And you give drugs to maintain vitamins and all that. They can go on for a while. But I have had a patient I've been seeing for almost 10 years with liver cirrhosis, and he's been stable. But the thing is, over time, such a patient might still need a transplant.
Surgery, okay.
A liver transplant, because it's a progressive illness.
Okay. Okay, basically, this is where we come to the part of the show where we focus on how can someone get help. Does Nigeria have the facility to take care of its patients? Now, we say a lot of young people are having this disease. Do we have the capacity to care for our young? How functional is the Nigerian healthcare system in this department?
Well, the truth of it is that a lot needs to be done. And I think the important thing that needs to be done is awareness.
Okay.
A lot of people are really not aware of the disease and of the help that they can get. So awareness is key because if you don't know much about the disease, you will not seek where for any treatment elsewhere. That's one. Awareness on the part of the general public, on the part of other health practitioners who are not specialists.
Okay.
Because I've seen people who have been told they were fine and they were seen by a medical doctor. But perhaps they're not aware that some things have changed, especially in the field. Some things have changed. We are not so many gastroenterologists in the country. That's the truth.
Okay.
In FCT, I think we are just about 6 of us in the whole of FCT.
Really?
Yes. That's specialists, gastroenterologists,
Enterologists,
and hepatologists. We're just about 6 of us. Okay, so then we're scattered across the whole
tertiary health
tertiary
institutions.
institutions, and a lot of patients complain to me, oh, when I come to see the gastroenterologist, I'm given 3 months appointment, and I say, I'm so sorry. If we leave it open, 100 people will show up on a clinic day and we can't handle it.
Yeah.
You understand? So, number one, there needs to be a lot of awareness.
Awareness, yeah.
Because we're also finding that there are a lot of quacks going around
Okay.
proposing to cure hepatitis. We have NIDAS. The NIDAS, there are some areas, some key areas in the FCT where they come around and gather people, share some drugs with them, collect some money. And it's very sad because I've had some of those patients come down with complications, liver cirrhosis, and they said, oh, but I went to that place and they said that I was fine, that I was cured. I said, no, you're not. So a lot needs to be done, and I think the main thing is awareness. Awareness to the general public. You can't get cure from anybody standing on the roadside and selling you some products.
Drugs, yeah.
Yes, and awareness to also the health practitioners that there are specialists available, because a few years back there were only two gastroenterologists in the whole FCT, so
Okay.
you can see it's stretched.
Okay. Ma, we've run short of our time already. When the program is interesting, that's when we don't have time to talk about all that we need to talk about. But I promise Dr. Egwuage will be back in the studio next week to give us more details on this issue of the liver. It's a very delicate situation that a lot of young people are coming down with liver issues. But first of all, you need to know when you get sick, go to the hospital. The liver infection, liver disease is a very delicate situation that can kill you in 1 year. So go to the hospital and check out your condition. Okay, thanks for coming to the show, ma'am. This is where we draw the curtains on the program today. Please join us again next week on another fresh edition of the program Health Review. Thank you for being part of the show. I am Chika Onyisi. Bye-bye.